So hi everyone, I'm Sam Alkin and welcome again to our weekly COVID-19 and food safety office hours. With graduation just around the corner here, everyone's looking to a carefree summer. And while COVID-19 is definitely more under control, it's not gone. I don't know about you, but I feel like I'm always checking over my shoulder and everyone is kind of responding to this differently, right? Some people don't have a mask left in the house. Others are diligently donning one each time they go to the grocery. And for some, it's been a very difficult stretch of a few years. And so we spend a lot of time on these office hours talking about the physical and visual symptoms of COVID-19, how to control transmission, but not a lot, right, about the, invisible impact on, our mental health, that of our family and our coworkers. And so this month is Mental Health Awareness Month. And I think it's very relevant then to talk about the mental impact of COVID-19 and what resources are available to help ourselves and our colleagues and families deal with it. So today we've got two wonderful guests to kind of talk us through those needs and resources. We have Kate Downs, who is the outreach director of New York FarmNet, and she's been helping grow and sustain successful farm operations and healthy farm families throughout New York. In her role, she's become a leader on issues of rural and farm mental health, and she works cooperatively to provide resources and support systems to the ag community. Kate's work is shaped by a passion for community and an agricultural connection spanning back to her childhood. She holds a Master's of Science in Sustainable Ag and Rural Development from University College Dublin, Ireland, and a bachelor's degree from SUNY Cobleskill. We've also got Joe Simcoe, who works in the Office of Mental Health for the Central New York Field Office as a mental health program specialist. He's been there for 6 years and has over 25 years of experience in community-based mental health services. And his specific areas of attention are Medicaid managed care, community-based services, crisis services, right? A lot that factors into COVID-19, and the needs of rural communities throughout Central New York region. So we're excited to have them. We also, as always, have our standard panel here to answer any general questions that come up around COVID-19 or food safety later on in the session. We have Dr. Olga Padilla-Zakor, who's the professor of food science here in the department and also the director of the Cornell Food Venture Center. We've got Dr. Martin Weidman joining us. He's the Gellert Family Professor in Food Safety and the co-director of the New York State Integrated Food Safety Center of Excellence. We've got Tommy Saunders joining us today from the Produce Safety Alliance. He's the Southeast Regional Extension Associate. We've got Dr. Aliosa Trimick, who's the Dairy Extension Associate and COVID-19 Resource Guru, calling in sometimes under the name of Casey McHugh this time, but he's there if you've got questions for him. We've got Dr. Callie Neal, professor of microbial food safety in the Department of Animal and Food Sciences at the University of Delaware, where she explores the transmission of public health and food safety relevant viruses and pathogenic bacteria. And I'm Sam Alkin, assistant professor here in the Department of Food Science with a focus on dairy food safety. So before I hand it over to Kate and Joe, just a reminder that if you have questions, feel free to type them into that little chat box. If you click chat at the bottom, you can type it in there. You can either send it to me or you can send it to the group, whichever, and then I will read it out to the panelists to answer. Or we have a smaller group today. You can also feel free to unmute yourself and ask that way. So with that, I'll invite Kate to the virtual stage to take it away.
Thanks so much for that intro. It's good to be with you all today. Bear with me while I work on sharing. All right, we good? All right. So as Sam so kindly introduced me, I have been the outreach director for a few years now with FarmNet. I've been at Cornell for almost 8 years in various capacities, but since joining FarmNet, I've really taken rural mental health to the next level with our program. And so I'm going to talk a little bit about why we need to, why we should acknowledge mental health, and then also resources that New York FarmNet provides here in the great state of New York. And I recognize that not everybody on the call is from New York, but this is just a snapshot. And I know Delaware is the Delaware Extension is doing some good work too. So I'll throw those out at the end. Here's my contact info. That was actually me and my dad a couple winters ago. We do maple sugaring up on the Tug Hill region. So that was a small snowstorm we dealt with a few years ago. putting out lines. So a while back, American Farm Bureau Federation, in partnership with Morning Consult, did a poll of rural adults and farm owners, farm workers, farm operators, and family members about, how does mental health impact, how has it impacted them? And in 2019, that was the original poll. And at that time, 75% of rural adults said, yeah, mental health is important to us. Or I'm sorry, I misspoke, 69% in April 2019. In 2020, 75% of rural adults said mental health is important. So that has started to increase during COVID, which I'm sure is not a surprise. 87% of farmers and farm workers say it's important to reduce stigma about mental health in agriculture community. And, I use agriculture here in a really broad sense of folks who work in our food industry and the people who grow the food and all of that. And 66% of farmers and farm workers said that COVID-19 has impacted their mental health, while 53% of rural adults say it has impacted their mental health some. Of note, out of these numbers, younger rural adults are more likely than older rural adults to say they've been impacted by their mental health. So I think it's interesting that farmers and farm workers, so people directly growing our food and producing our food, noted more of an impact on the pandemic, which I think for those of us in the industry is not really a surprise, but it's just interesting to have those numbers to kind of quantify those feelings and those things that we hear. Farmers and farm workers are more likely than other rural adults to experience nervousness, anxiety, or feeling on edge, 65 versus 55%. The social isolation, which farming is already a really isolated profession, and then you add a pandemic where we have to social distance and isolate, that has impacted their mental health even more. And they're more likely, farmers and farm workers are more likely than other folks to say stress and mental health have become more of a problem in their community, and that more people are experiencing mental health challenges than they were a year ago. So that was 2019 versus 2020. Again, I'm sure these numbers aren't a surprise. It's just, there's not a lot of research or data being collected on farmers' mental health out there. I know Delaware, actually, I shouldn't say that. Delaware is doing a really great job. Delaware Extension, in partnership with Maryland Extension, they are teaming up to do good stuff, but actually having hard numbers like this it's pretty rare. So when American Farm Bureau came out with this was really incredible and very useful. But the real kicker here for me is that most rural adults say that cost, availability, accessibility, stigma, and embarrassment were barriers if they were seeking help for a mental health condition. So it's this slide right here to me that says, this is why we need to talk about not, reach out for help, not feeling well mentally, physically, emotionally, but also that we just need to keep talking about this to help reduce that stigma, to help reduce that embarrassment, because when we're struggling, that can be a really hard time to reach out for that kind of help. But if we talk about it kind of all the time, like now we're talking about COVID-19 all the time, and how that's, mentally draining and physically draining, and just kind of making it part of the norm. Like we need to talk about mental health like we talk about physical health. And this is actually something I tell farmers all the time, that because, they're really good about asking for help with their animals. Like if their cow's not doing well, they will ask for help from a neighbor, or they'll call a vet. If they were to have appendicitis, or, they weren't feeling well, they would go to the doctor and then they would have surgery. Well, if our brains aren't feeling well, we need to go to the doctor and talk about it. And it's okay. Like these numbers here show that lots of people are feeling this way. And what I do when I talk to folks is just remind them that they're not alone. Lots of people are going through this. myself included, my family included. So we're all struggling, through these really unprecedented times. So those are just some numbers I wanted to share with you to show that this is part of a national conversation. And actually in the past year or so, American Farm Bureau has really taken a really positive move toward talking about mental health in agriculture. They've adopted the Michigan State Extension Farm Stress curricula and have shared that throughout USDA and are partnering with USDA. So there's really like this movement to help shift that needle just a little bit in talking about rural mental health. Does anybody have any questions before I'm going to switch over to FarmNet spiel in a minute? Okay.
If there are any questions yet, put them in the chat box, but I don't see anything yet.
Sweet, thank you. So New York FarmNet, we've been around since 1986 in response to the national farm crisis of the 80s. And we provide free and confidential on-farm consulting. So what makes us unique is that we go right to the farm. We go right to the kitchen table. We walk around the milk house. We kick the tires of the tractor and we meet with the farmer where they're at, or the farm family, or the farm worker, and talk about what's going on. And we have 45 consultants throughout the state who make this work possible. About half of them are financial consultants. So they're the farm business management folks who know the ins and outs of running a farm operation. And then we have family consultants who are actually social workers. And those two folks go out in these teams to provide these like wraparound services for farm families who may not have access to other types of care, which I think Joe might be talking about a little bit later. And so I think that's really, really interesting. We're one of the only programs that I know of that is set up exactly like this in the entire country. And I'm really grateful for the folks at Cornell who set this up back in the 80s. And we are still housed at Cornell. And we are funded through New York State Department of Ag and Markets and the Office of Mental Health, actually. They provide our main chunk of funding each year. So we're really, really grateful to New York State in recognizing that this is critical work in supporting our food systems here in the state. We have an 800 helpline that we answer during business hours. It's myself or one of my colleagues, or we have a web form that folks can go online and fill out because sometimes talking to a person can be really hard. As I said, we help any farmer in New York State. They could be a beginning farmer, an experienced farmer, someone trying to retire from farming, which I know is sort of an oxymoron, but it does happen, or someone who is transitioning the farm to the next generation or outside the farm family. We work with farm families, so the partners or spouses or the kids. And then we also provide direct service to ag business employees, so ag lenders, extension educators, milk truck drivers, veterinarians, nutritionists, because we know that stress doesn't stay isolated. If you're working with a farmer who's really stressed out, that stress spills over into all these other areas, especially if you're maybe not getting paid, like a veterinarian or a nutritionist, and then also farm employees. And we're working on building our farm employee capacity and hopefully getting translation services in the coming year. So we work with folks on financial analysis and decision-making, business planning, family relationships, because our farms in New York are family run, like 97% of them are. So there's usually multiple generations working side by side. Again, this probably isn't new to many people, but it can be really hard to work with families. So we help with some of that interpersonal conflict and some of those challenges. We love to do retirement and estate planning as a preventative risk management type of thing, because we want there to be a plan in place so that the family isn't scrambling while they're grieving if that the senior generation dies. We help with business transfers and how to run a family business, as well as personal well-being, and then obviously educational programming like this. We do a lot of succession planning workshops in partnership with Extension. We do quite a few stress management workshops with, farmers, industry folks, all across the board. So really we hit a lot of different pieces of the farming puzzle and the food industry puzzle. And we're really glad to be here today in helping you understand what we do, knowing that we are a resource that can support you. The cool thing about FarmNet is that it is a self-referral service. So you can mention to a farmer or someone you're working with, like, hey, I noticed you seem a little bit out of sorts. And do you know about FarmNet? And we're free and confidential. So, we're not asking them to drive to, an office or anything like that. We'll come out we're just another vehicle on the farm, right? We're not wearing suits or ties, or we're just wearing jeans and boots. And, if you're interested in getting FarmNet materials, we can send you some brochures to hand out or just to have on hand. And you can also encourage them to call our 800 number or fill out that contact form, and that will generate an email. And we're, pretty quick turnaround time, usually less than 24 hours. We get back to that person if they reach out, and have a case started and then have them starting to work with consultants. So we're pretty quick with that. And, we get some crisis calls where farmers are on the edge, and we have to ask them about suicidal intent. And in those cases, we respond to them immediately and connect them with resources, because we're not there to replace the resources that the Office of Mental Health has, but sort of work as a partner and sometimes an advocate for them. So I think, there's always the National Suicide Prevention Lifeline as a great other resource. That's actually switching over to 988 this summer, so it'll be a lot easier to remember. And also the crisis text line is a really good number, that 741-741. It's really great in tricky situations where you're not sure what to do. There's folks that can help guide you through your next steps and how to take care of yourself and someone you might be working with. And I think that's it for me. That was a lot of information I just threw at you, but pass it over to Joe.
There's a lot of great information. Yeah, and if you have questions, we'll ask them after Joe goes. So go ahead, take it away, Joe.
Great, thank you very much. Appreciate it. I'm going to share my screen as well and start off with the title page. It's got my contact information right at the bottom here. So if you do want to follow up with me after this is over with, you can certainly shoot me an email. I'm happy to respond with whatever information I can to provide follow up and more information. As Sam explained, I am from the Office of Mental Health. I work in the Central New York field office, which is one of 5, and we'll get into that a little bit more among New York State. The Office of Mental Health has responsibility for the public mental health system across New York State, and it has many different components to it. If you're not familiar with it, it can be a little bit overwhelming and daunting. By the public health system, it references in a lot of different ways. Most of the services that we do are for individuals that receive Medicaid services or Medicaid benefits. So that makes it a public system. But it also, as we'll get into it a little bit further in, a whole lot more, and serves potentially every New Yorker across the state. We have the responsibility of serving more than 700,000 individuals each year. As you can imagine, we do operate about a dozen state psychiatric centers across New York State for those with severe and significant mental health issues. But we also operate and oversee 4,500 programs across the state that are operated by local governments and nonprofit agencies, and many of which you may be familiar with within your own community. We'll get into a full list of all of the services that the Office of Mental Health oversees in many different ways, both at the state and local level. Some of those include crisis emergency services. I'm going to get into a little bit of that. Kate introduced you to the National Suicide Prevention Lifeline, soon to be 988. I'm going to delve into that a little bit more specifically a little later, and all of the services that go into that. We do have hospital inpatient services for adults and children. The majority of all of our services are outpatient based, clinics, school satellites, community-based treatments, and personalized recovery services that meet the needs of everyday individuals in the community, in their own communities. We also have residential services, community residences, apartment support programs, and single room occupancies that meet individuals' needs based on what their living environment needs are in various communities. Community-based supports over and above the outpatient services like care coordination and community-based services, where the services are brought not just to a clinic in a community, but actually into the person's home and their own community environment, wherever they live, work, go to school, and leisure, and then outreach as well. We are very much and growingly involved with the criminal justice system. We have police, probation, and parole partnerships. We work collaboratively with the court systems, with treatment and mental health courts in several communities, and then have jail treatment services for individuals that are incarcerated and needing services as well. Advocacy and self-help groups include family and peer advocate supports, as well as recovery centers that are peer run and provide the opportunity for support and education from individuals who themselves also have mental health issues or experiences. And then a whole category of education and employment services as well, helping people to complete schooling and obtain employment. This is the homepage for the Office of Mental Health, and a couple of things that I just thought I would highlight here is a whole section on COVID-19 information. It has been a major source of topic over the last couple of years for us as well. And not only in terms of meeting individuals' needs that have mental health services, but also supporting our workforce and making sure that our workforce remains safe from COVID-19, so that we can continue to be out there and meeting people's needs on a daily basis. We also have crisis information here, always recognizing the need for people in crisis, not to mention the ongoing increasing crisis needs that people have had throughout the COVID experience of the last couple of years. And then I also wanted to point out on the far right-hand side there, the Find a Mental Health program. And that's the highlight here of all of the services that we offer in New York State. If you're interested in finding what's available in your community, we have that available on the OMH website on the Find a Mental Health Program search page. When you click on it, you will get this query where you get to search by county, region, city, program categories, types, even by program names, so you can get familiar with what's right in your own community and who's providing what services where. I mentioned at the beginning that I work as part of the Central New York region. That's the 20 counties that make up the whole center of New York State. There are 5 field offices in the Office of Mental Health that cover the entire state. And our responsibilities are to be that liaison and that connection to the local communities, to each of the counties, and to where the services are being provided. So I work on a daily basis with county directors and community providers of services to make sure that services are being provided to the best possible way that we can, and people's needs are getting met. All of the contact information is listed there on the page with the regional designations to make it easy for reaching out for assistance even on that local level for our offices. I mentioned about the the work that we do on the county level, each county is required by law to have a director of community services whose responsibility it is to oversee the development and improvement of local services. Those county directors not only see the mental health services for their county, they also oversee the substance abuse services and services for individuals with developmental disabilities as well. So they've got a big task for each of their counties that they're responsible for. In working with them as well, they also have what's called single point of access, or SPOA, which is a centralized intake process for referrals of individuals with intense significant mental health needs. This is a point of contact as well for individuals who are seeking services or seeking to connect a loved one to services so that they can gain access. I put the link in there for the local mental hygiene departments, the contacts, and give you the contact information for every county in New York State so that you can know who your local director of community services is for your county, as well as your single point of access. So now you've got 3 different points of access to services, right? You've got the Office of Mental Health, whether it be through the Find a Program, through the field offices. You've got the Director of Community Services, as well as the SPOA, as far as access to what services the Office of Mental Health has to offer across the state. But let's get a little bit, before I go, I was going to go a little bit broader. There's one other community level involvement that I wanted to just chat about a little bit too. And these are an example of some of the local entities, population and rural health networks that we work directly with and have partnerships with. These are folks working right in the communities, everything from education to prevention to coordinating agency providers and health systems to, doing those, rural farm stands and some of the food prescription programs that you might hear about in some communities, some travel management services in some communities where there's lacking public transportation, really doing, yeoman's work in the field, on the ground, filling the gaps where we just may not be able to reach services in every part of the state. Some of these providers were able to do some of that stuff. And these are just a handful of the many that we work with. I drew this from my own experience working in the central New York region. So there's as many in the various regions, field office regions across the state, doing much the same thing in other portions of the state. This is just really kind of a small example of that. Wanted to introduce you to one of the programs. I'll introduce you to a few of them that we have championed over the course of the last couple of years to try to bring attention to the mental health needs and making sure that folks are getting the services and supports that they need. Really trying to break down those barriers like Kate was talking about of mental health being a stigmatized thing. It isn't. It doesn't have to be. We all experience some level of stress and anxiety in our lives, and it's okay to say that every once in a while. And that's one thing that we've learned from this whole COVID experience is we need to be able to say, I'm stressed, I'm overwhelmed, I'm anxious, and have supports there to back us up. And when it comes time to reach out for services, if at any point that you or a family member or a loved one has that need to get supports and services, there shouldn't be barriers in the way to accessing that. And the CHAMP program is one of those ways that we're trying to break down those barriers. What CHAMP really does is work through some of the access issues that Kate was talking about as it relates to health insurance and access to services and what's covered. I mentioned that the New York State public health system is predominantly for folks that receive Medicaid benefits. But we can also provide supports to individuals who have commercial insurance through your employer or through the New York State marketplace. Any type of insurance shouldn't be a barrier to getting the access to the services that are needed. So CHAMP provides that access. Contacting this 888 number and reaching out and asking questions about the level of insurance you have, the services that you're interested in, they will help connect and ensure that you can get access to those services regardless of what your insurance coverage may or may not be. And we're going to make sure that that happens. So we wanted to know about that. We are, as a state, working very diligently toward mental health care parity, meaning that commercial insurance covers the same thing in the mental health realm as it does in the medical realm. There's no greater barriers between you needing to get health care and or mental health care. It shouldn't matter which you need. So that's where the parity comes into play. So we have instituted laws and are working with the insurance providers to make sure there's equal access to mental health care, just the same as there is to health care. So that's a little bit about CHAMP and the work that's being done to increase access. Another new initiative that you've probably seen commercials for throughout the course of the last 2 years is New York Project Hope. We initiated this back at the beginning of the COVID pandemic and opened up an opportunity for individuals to find ways to deal with the stress and anxiety that came along with the COVID pandemic. It has provided a hotline service for individuals reaching out and dealing with the COVID-19. Now, this has not been an initiative that's been specifically identified as a mental health initiative necessarily. It's simply coping with COVID and getting through the struggles and anxiety, and hopefully thereby reducing kind of the anxiety, the stigma that comes along with the mental health label, and saying, certainly during this COVID pandemic experience, we're all having some levels of stress and anxiety that needs to be dealt with, and there needs to be resources to get through it. So there's the 800-844 number, free anonymous, still running, still continuing. We don't have any plans on stopping this anytime soon, regardless of any changes in the pandemic and the declaration of the public health emergency. So that continues to be a free and available option for all New Yorkers to deal with. It's also offered some additional opportunities as well. There are education programs, there's social media support, there's online wellness groups that's being offered through New York Project Hope. There is in-person community-based service as well, located in several areas across New York State. All of these services are free and a support to help get us all through this whole COVID experience. 988 is another great big initiative that's going on, and Kate talked a little bit about the National Suicide Prevention Lifeline. She gave the number for it. As of July 16th, the new number will be 988. That old number will still be there and will be live, but it is going to be a whole lot easier to remember a 3-digit number as opposed to a 10-digit number. And it is going to serve the needs of individuals that are experiencing any kind of mental, emotional, social stressor, as an alternative to, just like 911, only instead of a physical and medical emergency, more of a mental, emotional emergency or crisis. And it could provide anything from very dire emergencies to just having a place to reach out and connect with someone to talk to for support. It is just a component of an overall crisis system that we are building across New York State. You're going to hear a lot about 988 as like the big push or media information, but behind the scenes, there are a lot of new initiatives going around to provide crisis services for people in mental health and behavioral health crises. That'll include mobile crisis teams in every community across New York State, where if having that phone call isn't enough, someone will actually come to you and respond, much like an ambulance does. In this case, it would be within a 2-hour response time frame to work through that crisis scenario. And then there's also going to be locations to go to, like an ER, but to deal with mental health and behavioral health crises, like residential locations and stabilizations. We do have psychiatric emergency rooms in some hospitals, but we're going to expand that out to residential respite and stabilization centers as well. So there are actually places to go. And we're building upon that with various law enforcement partnerships as well, I talked about in the beginning, so that no matter if you call 911 or 988, you're going to get a response, and we're supporting one another through the law enforcement partnerships, so that we can help them do a better job in terms of responding to behavioral health crisis situations, so that they can be out there dealing with the other work that they need to do while we kind of take over some of the behavioral health crises. So it's a whole continuum of services for folks, even beyond just the 988 call center that's soon to be available to all. Lastly, I just kind of wanted to round out, similar to what Kate did, and talk a little bit about the mental health needs of our population as a whole. 1 in 5 New York adults experience a mental health disorder in any given year. It doesn't have to be stigmatizing. It doesn't have to be some of the stereotypical things that we might think of when we say mental health. It doesn't necessarily have to involve psychosis or major depression. It can be anxiety or stressors. So if we acknowledge it in that way, then we recognize that it is actually much more common than what we might be aware of. It does lead to a significant contributor of suicide, which is the 10th leading cause of death in New York State, and the second leading cause in New York State for people between the ages of 10 and 34 years old. And we know as a state that less than half of adults and less than a quarter of children and adolescents actually get the supports and services that they need. And then when we drill down into those rural communities, we know that there are even more significant impacts. Kate talked about the isolation and the stigmatizing that goes on in those rural communities. And that makes it even more difficult for individuals living in those environments to get the services that they need. I don't need to go through all of these statistics that are on the screen. It's available to you. You probably are very much well aware of them, those increased issues that are faced on those rural communities. Just wanted to highlight that here in a means of acknowledging it and saying that we are available to help, and hope that you take the opportunity as you're talking with your friends and loved ones and find that somebody's experiencing some level of stress or anxiety, to say that there is support and there is help available, and get them connected and make sure that it can come out in a much more positive way than some of these statistics that are listed here on the screen, as we offer all of those supports. I believe that is, so there's some resources that are available for some further information, many of the things that I've gone over today. And like I said, my email's at the beginning of the presentation if you have any questions following today. And that is all I have regarding the Office of Mental Health.
Thank you, Joe. It's a great overview of the resources that are available and kind of some of the statistics and needs. So